My name is Anita Teresa, and tonight I'm going to be talking about sex and medicine, and a little bit about how I came to be talking about this topic and talking, to different audiences about it is because of a background in clinical settings and working in hospitals, working as a social worker, then eventually getting into holistic and integrative health and studying the body through the frame of somatic movement, so like the parallel to physical therapy, mind-body therapies, hypnosis, and all these different ways of connecting to the intelligence of the body, and working then with very ill people with chronic illness, people before surgery who were extremely anxious. Have you ever had surgery? Anybody had surgery here before? So, just that high level of anxiety, and teaching people to deeply relax, how to deeply relax in the actual hospital setting through hypnosis, through connecting to the breath. So I did that for about 5 years at NYU Hospital. And it was kind of amazing. I didn't have to be a doctor. I wasn't a nurse. I had clinical training, but I was like this secret agent there infiltrating the hospital setting and getting to help people in a really real way that would have results like less pain, less use of less anesthesia during surgery, and quicker recovery time. But what I saw was missing from the picture, from the landscape, especially in the holistic world, which is already about connection and looking at all the different facets of health, was sexuality. Sexuality was just not talked about in many domains, but especially in a setting like where people are sick and there's no talk of pleasure, there's very little of the human, more subjective aspect in the culture of the medical world. And for both practitioners and for patients, it's not a very pleasant experience to be in the hospital. If any of you have spent time with a loved one or spent time yourself as a patient, you know that it's a bleak, very cold, very sensory impoverished place. And I found as a provider and as part of that community that the staff was actually emotionally and sensually dehydrated. That's how I'd put it. People were just disconnected from the pleasure of being alive, just simply being alive. That it's just, going on automatic, working many, many hours on your feet as a nurse, for example, or a doctor. And as a result, there's a lot of pathology in the medical community. There's very high levels of suicide, triple the rate of the average of any other industry. That, welcome, have a seat anywhere you like. That medical doctors have triple the rate of suicide of any other profession. And dentists, that nurses often have terrible back problems and have to retire often early, forced into early retirement because of spinal stenosis and other issues. Just from years of overwork and misuse of the body. And what I would also say is that the culture of suffering, like the whole culture is permeated with this paradigm of you have to work really hard to have results, and excellence means you can't play, you can't have pleasure, you have to deny those other aspects of being human. And just driving and driving and driving until people break. Psychologically, there's very high levels of depression among the medical community. There's very high levels of divorce and drug abuse. So just those observations from being inside of the culture, and if those are the people providing you with health care, it's like pretty bleak. It's not a very good equation there. So I became very passionate about empowering clinicians and people in healthcare and people at large to reconnect with their sexuality in a healthy way, in an empowering way, and to then be able to, from that place of being friends once more with the body, with the sensuality, to be able to transmit that to the patient, so that the patient is also like, wow, I'm at ease with my doctor. That's amazing. I feel like I can trust my nurse because she also trusts her body and that primal basic intelligence that comes from knowing and connecting deeply to the body. One thing that my boss at the time, the director of the Integrative Health Department at NYU, said to me once was, when they were considering what to do with me, because I was kind of like this unknown quantity, and they decided, she's like, we really like you. You're comfortable to be with in a room. You're clearly friends with your body. So we'd like to double your salary and just decide whatever job you want and write a description and send it to me, and that's what your new job will be. So it's kind of amazing. I'm like, sure, okay, this stuff works. So underlying all of that phenomenal experience of being in a really conservative environment that's not friendly to the body, to being handed a job, and the manager who was having friction with was actually kind of removed from the picture, and I was just became a free agent in that system. Was that at the same time I was working very diligently on sexual energy practices from the Taoist tradition, from Tantra, from other sacred sexuality traditions, and it's all based on this primordial access to the primordial wisdom. Is it up now? Here we go, ladies and gentlemen. The PowerPoint has arrived. I don't even know if I'm going to use this, but we'll see. So thank you for getting it up. So I had been deliberately working with these very ancient practices from Taoism to recycle sexual energy through my system for the purpose of health, to be healthier, to be vital, because as you all know, whatever profession you're in, there are tremendous demands on everyone in the modern world. There's just tremendous demand on the nervous system, tremendous demand on the immune system, on the endocrine system. I would say probably 70 to 80% of women in New York City suffer from adrenal fatigue. It's just constantly being bombarded, worn down, and having this kind of low-grade fatigue plague your day-to-day reality. That's not normal. That's not how we were designed. And so my way of bypassing that pretty much inevitable conclusion of just fatigue and not being all the way alive and trudging through the day and really struggling to get out of bed and go to work was to do these sexual energy practices that changed my life. I became more vital. It's like a process of aging in reverse. And there are practices for women, there are practices for men. And I was just like, this is amazing knowledge. And this was developed by, in a monastic tradition, by priests who were like, let's tap into this sexual energy. Let's not repress it. Let's tap into it and utilize it and harness it for longevity, for reversing the aging process, for optimal endocrine health. So hormones in balance for women, the disappearance of PMS, the coasting through menopause, not having crazy symptoms, for men feeling more vital and feeling young, being and looking younger and having more energy. All these sort of things they discovered, and they perfected that system. So anyway, that's a little backstory about how I got to this point of then sharing this knowledge. And then I put together a summit earlier this year for healthcare practitioners to learn about healthy sexuality in order to be able to cultivate that in their own life, a healthy relationship with pleasure, and embody that so that when they're serving other people who are in crisis around their health, they can have a much higher baseline of immunity, of well-being, mentally, emotionally, physically, and that their life can be suffused with more pleasure, with more bliss. And that's really been a passion now, to share this knowledge. So let me see what we've got over here next. Do you have like a pointer or anything?
Well, unfortunately not.
So, and okay.
I can keep going.
Hello, welcome.
Just tell me when.
Okay, thank you. So I'd love to also have a dialogue with each of you. Since you're here, you showed up for this. It's a conversation that I think our whole culture can benefit from, and start to ask these questions, like how were sex and medicine connected in the past? What did that look like?
Separate.
Yeah, they are currently like separate and it's taboo, but they weren't always like that. So how are they connected in the past? When and under what conditions is it appropriate for a healthcare professional to bring up sexuality with their patients? Because one of the main obstacles is liability. People are worried about harassment, being sued, so they stay away from the topic when in fact it often is really important, especially in light of how much sexual trauma there is for both women and men, not just in this country, but in many parts of the world, that it's almost like an epidemic of sexual trauma. And so that does play a huge role in, this is my own theory, but the research is just starting to get there to show the connection between sexual trauma and autoimmune illness, especially with women, because 70% of people with an autoimmune disease are women. 70% of people who access the healthcare system in this country are women. But medicine is not really conducted for women. It's the basic model or the template is men. But women have very different needs than men. Our endocrine system is much more delicate and complex. The emotional, mental, biological connections are all very complex. Not to say men aren't, but it's just it's different how it plays out, especially when you're coming to the topic of sexual trauma, which plays a huge role in a person's function throughout the rest of their life. So why do you think sex is left out of the conversation? Or have you had a healthcare professional who was like, let's talk about your sex life. How's it going? Are you getting orgasms regularly? And how are they? And how long? Has that happened to any of you? Or no, right?
Could it add to the trauma if like somebody asks about it, it's like the person starts reliving it, or the actual question seems traumatic?
It all depends. I mean, in the summit, one of the people I interviewed was Sherry Winston, who's a midwife, nurse, RN, many years of experience with women on the table, getting exams. And she said, she trains healthcare professionals how to give an empowering pelvic exam, for example, for a woman. Let's say a woman has a car accident, or she's in a car accident, and she has to get an X-ray or some pelvic exam. A lot of times there'll be some kind of history of sexual trauma that won't be mentioned, it won't be written down anywhere in the chart, and that woman is getting an innocuous exam from a well-meaning doctor, but then gets re-traumatized by the exam, not because they're asking questions, but because they're not aware of how to communicate effectively with their patient and make it safe for that person emotionally to talk about or to notify them that, look, I have this history. When you go to examine me, this is what I need. Like, I need you to be very sensitive. I need you to be gentle. I mean, unfortunately, some of these gynecologists, they're not trained. They get about 3 hours of training on sexuality. 3 hours. It's just like doctors with nutrition. They get 3 hours of training in nutrition. It's the same with sexuality. And that's why I think sex is the frontier of, first of all, the holistic, integrative health world. And then after that, when it starts to permeate the mainstream medical schools, will start incorporating more training. But as of now, it's basically non-existent. Even people that are working with people's genitals all day long are getting 3 hours of training on sexuality. urologists, proctologists, gynecologists. So there's a huge gap in the training. Any other thoughts on these questions? Any observations, thoughts?
Well, I'm not in the medical world, but I think that the restrictions are probably less to do with the legal aspect, which I'm sure is part of it, but more to do with the practitioner's lack of knowledge and understanding and belief in that, there's a mental aspect to sexuality that has some kind of healing capabilities versus just the physical aspect of it, which is what
Right.
modern civilization kind of brought up. If I had to guess, I mean, I'm not.
I totally agree, actually. Yeah, I think it's part of the operating paradigm of our time.
Right.
Nobody's
If
really
they believed
trained.
in it in some way, they would find a way to bring it into their practice, but they probably don't believe it and probably haven't had experience with it. And it always starts with education, right?
Yeah,
To some degree.
yeah, exactly. Yeah, thank you for that contribution. Yes.
So, in part of my work, I work with people and counseling them with emotional and spiritual issues. And in the emotional, we get down to various emotions that are affecting various organs of the body. But as of yet, I have, when someone's root chakra has issues, I'd be interested in knowing how to bring up this issue, which I have not to date. And actually listening to you, I'm like, why haven't you? But
Yeah.
how would you do that in a clinically acceptable way, in a sense?
Right. Yeah, so many people are afraid to touch the topic because it's sensitive and it is vulnerable and it's charged. It's very charged. So without training, it can be feel like too big of a dragon to tackle. Like, what if that person freaks out, or they accuse me of harassment, or it just feels awkward, and those are completely legitimate reasons, but it shouldn't be where we stop. We shouldn't let those things stop, because there are very particular, very easy tools to learn just to communicate. And I think one theme in the summit, I interviewed about 24 healthcare practitioners, sex therapists, psychiatrists, doctors, midwives, different people that had perspectives on sexuality from a holistic standpoint. And the one common thread through all of these interviews, 24 hours of interviews, was curiosity. Like being curious as a starting point, not just for our own sexuality, but for that of the other that we're trying to help or serve. And this plays out in life in general, with just in the context of partnership. Being curious is what regenerates that the kind of erotic innocence, you could say, of just the fact that we're sexual beings, and from the time that's how we got here, that's why we're here. Two people had sex, So it's just getting back to that kind of primal innocence, and a state of curiosity is a great way to start, to kind of cultivate that state of curiosity. And doing it for yourself, I think the inquiry has to begin with yourself as a practitioner or as a lover or whatever, just to be curious about your own body and become friends with your own body. That's the basis for anything that you can then give to another person. So, shall we move on to the next slide? Some interesting things that I learned from the summit. One of the most fascinating connections was with micronutrients and mental health and sexuality. I interviewed a psychiatrist who's based here in New York City, and she has an integrative practice. So before she gives any medication, before any kind of radical therapy, she assesses her patients' micronutrient levels. So if they're depleted in magnesium, that's the first thing that she tests for. And that is often very connected to their, the symptoms that they're coming in for. So if there's magnesium depletion, then she gives them magnesium, their dopamine levels go up, and their depression goes away, or their sex drive goes back up. If they have no libido, so it's looking at it from a functional, very practical level of the micronutrients, if there's low levels of vitamin D, low levels of zinc, nitric oxide, another one. So she gives them supplements, she helps them rebalance their hormones, and just starting with that eliminates, she said, up to 80% of the symptoms that people come to her with. 80%. So can you imagine if every psychiatrist or psychologist was addressing their patients that way, or just doctors in general? But especially with mental health, because it's also very charged, very taboo area. It's very sensitive. And it's completely interconnected with sexuality. In my opinion, from my own observation, that a lot of it stems, again, from sexual trauma. That's unintegrated material that causes this somatic imbalance. It causes certain, like inflammation. It can lead to so many different kinds of symptoms. Everyone's tries to assimilate that traumatic experience in some way that their body will most readily go to. And for some people, that's migraine headaches. It's migraine headaches. I worked with many dozens of women who have chronic migraine headaches. And for a certain percentage, I could just see that it was sexual trauma, that it was the root of that. So that connection is really interesting, with especially around libido. That depression, of course, if you're depressed, you don't feel like making love, but that's what you should be doing because it's going to increase your serotonin and dopamine. So it's a vicious cycle. So she helps intervene at that level and also encourage her patients who have depression to make love. It's like, this is going to help you, Pleasure is medicine. There's, I'll go on later in this if we have time. There was a doctor that I interviewed who told me, oh yeah, I'm writing an article about the 238 health benefits of orgasm. I was like, that's a lot of health benefits. If that were a drug, if we could put that in a pill, it'd be like the #1 pill on the planet. So the funny thing, I always say, like, sex doesn't actually sell. Like, sex doesn't sell. It's the suggestion of sex that sells. But if people actually worked on the things that are the confronting aspect of sex is what keeps people locked in certain patterns that really don't allow them to flourish, or have the medicinal benefits of a really healthy sex life that they could be having. But real sex is actually very confronting because it requires intimacy and vulnerability. And that is, of course, a whole realm of sexuality that no one wants to talk about in a professional context. And it's still, we're pioneers. We're on the frontier of this. So, self-care practices. How many of you have ever heard of either breast massage or prostate massage? Okay, great. Yeah, where did you encounter that information or knowledge or see it? Or
Self-knowledge.
Yeah, you just intuitively knew that this was important. Yeah, great. Do you share this with other women?
I do.
Okay, good. Yeah, so needed.
Mm-hmm.
And somebody else raised their hand?
Yeah.
Yeah,
I heard about it on YouTube.
great. Okay.
My wife actually taught me about prostate massage, and she knows how to do it. So.
That's awesome. You're a lucky man.
No, it was a enlightening experience. Never before, I never even thought about that. She's a body worker, and she's like, well, and she was suggesting it to me. I'm like, well, that's really interesting. And finally, I came and was like, okay, let's, from a clinical, medicinal, holistic approach. She sold me. I was like, okay, and it was far out. So.
We should do another talk just on that.
Yeah,
It'd be interesting. Yeah.
For a man to, for a heterosexual man to explore that, I think there's a lot of barriers, I think, with that to a certain degree.
Right.
And so, but it was enlightening.
Very cool. Thank you for sharing that. And that those are just examples of really just what I would say is going to be part of the future of holistic health. When people talk about, well, you need to eat healthy and you need to exercise and make sure you get regular prostate massage and breast massage, that'll just be kind of all there because it's not separate anyway. And there's no need to leave it out of the conversation. And also, I think what's going to change about the way we talk about nutrition is that my hope anyway, is that it'll be more based on pleasure. That instead of, like, dieting will go away. That people won't diet anymore. They'll look at pleasure, food and pleasure, and really soak in that connection and savor the food in create a different relationship with food. That it's totally connected to the sensuality, to the sexuality. So that those things are very parallel.
So have you written on this? Do you have like a book or something that has all these?
I don't have a book, but I have the summit. It's online, and you can. The whole library of all the interviews is online, so you can access all of that. I'll give that information to you at the end. What else? So something else interesting. I mean, I learned from a naturopath in the summit, a naturopathic doctor who works with men in particular. He's an integrative urologist at NYU. Gio Espinoza. He's fabulous, really funny guy. And he said a lot of men are coming to him with erectile dysfunction who are below 40. They're like 20 to 40 years old. And it's not this idea of like some 70-year-old, 80-year-old man who's, can't get an erection. It's like really young guys. And it's this lifestyle. It's hard drugs, drinking, long hours, working on Wall Street, not getting rest, not drinking water, and just changing and modifying the diet and lifestyle, everything works fine. And it actually can also be an indication of heart or cardiac problems. So these are like little things that I'm just passionate to share about and be like, here, share this with your friends and people you know.
I heard that it's people who watch a lot of pornography, they get erectile dysfunction because they can't connect a real woman, they can't, that pleasure connection is lost because it's been switched into something else.
I don't know the stats, but I can't really speak to that honestly because I don't know. I haven't done the research, but maybe that's true. I don't know if I just am going on what I've learned from doctors and so forth, and from my own research. But it wouldn't surprise me. But I can't really substantiate that. So, yeah. So, somebody else have their hand up? No. Okay. Let's actually go to the next slide.
Excuse me.
Yeah.
Qi, what's that?
Well, okay, so in the Taoist tradition, everyone's heard of qi, it's this vital energy or life force energy. Jing qi is like the crude fuel, like the raw sexual energy that in the practices gets transmuted into other forms of energy, like more refined, more subtle forms. So for a man, the practices that are associated with this are largely centered around seminal retention. So not ejaculating often, but holding the semen and recycling that energy and actually packing it back into the vital organs through practices that are done daily. And that those men, and I know people who, and if I walk into a room and there's various men, I can always tell if someone is a practitioner. I can just see it right away. Or a martial artist. It's the same thing. It's just being able to contain and govern that energy, and it shows up in very particular ways. That it's like the presence, the vitality, the aging in reverse effect. And I've seen this in two very close friends of mine, both men who practice every day. They do these practices, and from the beginning of the time that they started practicing diligently every day to now, which was about 3.5 years, vast difference. They're both over 50. They both look 10 years younger. they both increasingly look more healthy. One of them, he's always like, I'm 6 months, no ejaculation. I'm like, wow, okay. But he's really serious, he's really committed to it, and I've seen massive results for him. So bone, like even polymeasurably, like bone density and tissues health and hormone balance, mood changing. So their whole theory was if you release too often, you're losing vital energy, you're losing your life force, and when you get older, it makes a significant difference.
That doesn't apply to women, right?
It's actually the opposite for women, so we're the lucky ones. Just keep going as many times as we can. Yeah. But also there is that recycling of sexual energy, but it's like accumulative.
Well,
It's
supposedly
really
men
great.
can still have orgasms without ejaculating.
Right, so they teach that method. Yeah. Which I think for any person in a high pressure industry, it's phenomenal. It's like better than any drug. So many people doing drugs is like they don't know any other way to get energy. They're lawyers working till 3 a.m. trying to make those cases and do all these things, and it's they're all taking drugs, and it's like, well, if they did this practice, they wouldn't need any of that. They would be more vital than people that are taking all those drugs, methamphetamines and stuff. So, I'm curious. I want to hear what is healthy sexuality? What does it look like to you?
I think of it as feeling at ease with, with your body and with, talking about sex. That's how I see it.
Yeah. Hi. Welcome. You can have a seat. Anybody else? Yeah.
I think it's the emotions that are associated with sex. When you're happy, when it's when there's a lot of love, that's really healthy. It feels right.
Yeah. Yeah.
When there's like anger and stuff, it doesn't feel as healthy. Sometimes it feels something's wrong. So, it's like the emotions.
The emotions that you express while making love, or the emotions
I think the
in
whole
general,
thing,
or
before, while, after, I think all the emotions are important.
cool. Anybody else?
Shame-free is a good word that you've got up there. There's a lot of guilt and shame that's
Yeah.
associated with sex, and the healthy outlook is guilt-free
Yeah.
and shame-free.
Yeah, I agree. Yeah. We have some open seats over here if you want to come. Anybody else? Just like, what's healthy sexuality to you? Connection.
Connect with what's going on in your body and with your partner.
Mm-hmm. Yeah.
Enjoyable,
Beautiful.
pleasurable.
Yeah, that would be great. Felt good.
It's simple, right?
It wasn't something you endured. It was like, when is this going to be over? Yeah. Yeah.
Like you said earlier, curious, being open and being open to the possibility of learning about yourself and play, experiment.
Mm-hmm. Great.
Yeah, that was what I was thinking too, like the act or the art of self-realization in the act too, especially with someone that's who's your partner.
Mm-hmm.
You can be a mirror for each other in different ways, but I think each, as we grow older, like go through our 20s and 30s and 40s, we learn about sex differently, therefore about ourselves. So it's an evolution, and to
Right.
take the approach that each time you engage in something with somebody, there's going to be something revealed, and to be able to have the awareness to see what gets revealed, either within oneself or in the other person. You never know what's coming up, especially if it's something random.
Hence curiosity. Yeah. Experimentation. I really liked that too. Yeah. These are just some, my own suggestions. There's no right answer, obviously, but
Just
yeah.
wanted to add
also sexuality towards yourself, so not
Yeah.
necessarily having a partner, but
Absolutely.
having that pleasure and having, the practice to do it with yourself
Yeah.
daily.
Totally.
would be
Totally
different.
agree.
And to learn to take the time, at least that was
Mhm.
important for me. We're kind of conditioned to think, okay, we're in the partnership, we kind of have to do it. It's like part of the package, right? But it's a different thinking of really self-loving yourself and really taking that time as if you're with a partner again.
Right.
Maybe, or on a
Yeah.
regular basis.
Totally. Yeah, absolutely. I agree.
So I think allowing yourself to be vulnerable too
Yeah.
is part of, I think, where you really get the deep benefits of it. Even just like this little discussion right here, there's just talking about it is vulnerability.
Right.
Just talking about my wife giving me a prostate massage, I made myself vulnerable. But to
Yeah.
that,
Right.
That's something that came up for me. It's like I'm very, very much a private person.
Mm.
I am talking about my wife who gave me a prostate massage, and I don't. There's no shame in that. There's
Mm.
nothing in that. She only did it once, but it was like it wasn't something that I sought out again. But nonetheless, it satisfied at least the curiosity in terms of the
Mhm.
benefits.
Right. And how will you know until you do it?
Yeah.
What your tastes or what your preferences or what will delight you or what will be like, no, it doesn't turn me on, or you can't know until you experiment,
Yeah.
right? Yep. Let's go on to the next one. When am I supposed to be done again?
You're supposed to be done at 8, but
Oh.
we started late. And
Okay.
I'm enjoying this.
Okay.
I'm not the organizer, by the way. I'm just sitting here.
This is an interesting statistic. This is from my own research. I decided to do a little research on how many organizations in the U.S. Dealing with adult sexuality what's the nature of them. So about 95% were like rape crisis centers, domestic abuse shelters, Planned Parenthood, and Teen Pregnancy USA, all these things. And I was like, trying to find where are the empowering ones? What are ones that are not about pathology? And then there were a few, like maybe 5% of what I found. This was 2 years ago, maybe. And it's like, wow, well, what if those statistics were reversed? Wouldn't we have a completely different landscape here in this country? I mean, we probably wouldn't even have rape crisis centers, actually. I don't think. It would be a tiny minority. But it starts with the education, like you were saying. It's that, and the more curiosity, and then the more the curiosity can kind of peel away the shame, the more then we can embody a healthy relationship to the body in front of children, and children can be empowered as well. Then it'll be a natural outcome that there's a sanctity, there's a natural capacity to hold that, like the containment of the sexual development process with integrity and without compromise. Thank you. Okay, let's go to the next one.
Can you explain a little bit more about, you said if you think that if the stats were reversed and there were more empowering sex education organisations, that rape culture would change?
I think because if a woman or like a little girl or a little boy is truly connected to their sexual intelligence, that the impulse toward abuse, sexual abuse, it doesn't need to, that's a distortion basically. The impulse toward the abuse is a distortion. So if that distortion is kind of mended and it's put into alignment and people are in harmony with that, with their sexual essence, that acting out, the abuse, it just won't even happen. That's my own belief. Something that Osho, you guys know who Osho is, the philosopher, said if you want to control or manipulate a people, you have to cut them at the root. So you start from the childhood to cut down, to repress, to deny their sexual essence. That's how you can very easily manipulate masses of people. Because that primal intelligence, the instinctual self that knows to protect itself, that every large mammal teaches its cub or whatever to growl, to hold space, to really occupy and inhabit their body. And in this society, we're not taught to do that, especially women. We're not really taught to occupy our space and hold that power, the primal power. It's like, be polite and cross your legs, and don't wear attractive clothes, because you don't want to, don't wear too short skirts. Like, that's not empowering, actually. That just sets up the conditions for victimhood, I believe. That's what I mean by
I
that.
read an article the other day that was saying countries in Europe that have more open discussions and open social atmosphere for sex have a much lower crime rate, sexual assault rate. And I think because the children grow up, they're more educated, they understand it more, and they don't have, I guess, some of the pathologies that might develop during previous childhood. Like France and Italy and some countries that you would think would be more open about it, didn't have much lower sexual assault rates.
Totally makes sense. Yeah. Yeah. With curiosity. And this is the final slide. It's perfect timing. So that's what I leave you with. And just in the desire to stay in the inquiry with as many people as possible. And I will just invite you to stay curious and maintain this conversation and open the dialogue with your parents and your children and your loved ones and your doctor. And, share the curiosity. And because I find, for some reason, the topic of sexuality is the most prone to judgment of almost any topic. It's just, no matter what your stance is, gay, straight, priest, nun, celibate, polyamorous, it's like there's judgment. It's just embedded into this realm of life. And so what kind of makes it easier to navigate through that judgment, in my own experience, is curiosity. Just like, what would it be like if we tried this tonight? Or, what would it be?
There are a lot of monastic people. Of course, there's priests, there's nuns. These nuns have some of them have tremendous loving energy. You can't. What?
I think it's rare.
Yeah, I mean, there are nuns who are really mean because I guess they're frustrated. But there's the ones that have.
The power of asceticism.
What?
Asceticism has power. Is what you're saying.
Well, I see. I just don't know. There's nuns, there's Buddhist monks, but you see a lot of also terrible things.
Yeah, I mean, it's everywhere. But I think it was Osho that was like, ashrams are full of neurotic people because they're repressing sexuality. It doesn't have to look like being married necessarily, because there are plenty of monastics that work with sexual energy, and that's part of their devotion. And that to me is a way to be in alignment with nature. That's like the Taoist tradition is just all about alignment with nature.
So those who work with their sexual energy tend to come out better than the ones who don't.
It looks like that way to me. A little less neurosis, probably.
So the government
Yeah.
should send you to work with ISIL, right? That would be the antidote.
Tickle them with ostrich feathers. That's what we should do to all of them. Tie them down and tickle them. So, any final thoughts or questions before we close?
Yeah, you were going to tell us how to connect with your...
Oh, yes. Did I put that in the last slide? Sexandmedicinesummit.com. Sexandmedicinesummit.com is the address if you want to access the summit. And then I also did a course online that's still available. All the recordings are online. And that's under my website, anitateresa.com/programs, or you could just go to anitateresa.com and find the summit and the integrative sexuality course. So come visit and let's continue dialoguing.
Thank you.
Yeah.